Hi, everyone. On today's podcast, we're going to talk about self hypnosis and an unmedicated birth story with chiropractor and EBB Childbirth Class graduate, Dr. Emily Guilfoy, and her husband, Doug, as they share their birth story. Hi, everyone, and welcome to today's episode of the Evidence Based Birth Podcast. I'm so excited to share with you today a birth story from our graduates from the EBB Childbirth Class. We have with us today Dr. Emily Guilfoy and Doug Guilfoy. Emily is a chiropractor and acupuncturist with a passion for supporting women from preconception through postpartum. Upon completion of her undergraduate studies at Washington University in St. Louis, Emily went on to complete her doctorate of chiropractic at Logan University. She maintains her certification in the Webster technique and is a diplomat of the American Board of Chiropractic Acupuncturists. Emily is married to Doug, a financial analyst, and together they were graduates of the EBB Childbirth Class with EBB instructor Anna Sikowski. Emily and Doug live in St. Louis, Missouri with their son Theodore, and they are here together to share their birth story with us. Emily and Doug, welcome to the Evidence Based Birth Podcast.
Thank you. Thank you for having us.
Yeah.
We're really excited to be here.
I'm so excited to hear your story because I feel like it touches a lot of points that people are interested in. And I was wondering if you could kind of take us earlier in your story to how you found out about the evidence-based birth childbirth class and like when you started deciding to educate yourself in this way.
Yeah. I guess I had heard about evidence-based birth through some of my chiropractic continuing education, doing Webster certification and other seminars like that. Evidence-based birth is very much promoted as a resource and as a website to go to offer patients just more information who might be interested in whatever topic pertaining to birth. But I hadn't really known about the childbirth class until we started kind of interviewing and selecting a doula. So this became really important to us, I think, as like just kind of a stepping stone, as background information that we wanted our doula to have and to have that groundwork in EBB. So we found Anna and she became our doula as well as our EBB instructor.
That's awesome. And so both of you were interested then in having a doula and getting educated as much as possible. Yeah.
Definitely.
We're lifelong learners, so this is right up our alley. Is perfect.
Yeah.
That's awesome. What was your experience like taking the class with Anna?
Yeah, we loved the course. We found, I think, the videos and the coursework to be really educational and very informative. Being the lifelong learners that we are, we took multiple childbirth classes from various resources, various avenues, but we really found like EBB to give us the most data and most information to really empower us in conversations with our care team and our provider to really make the decisions that were best for us and to create that birth plan. I think like one of my like the best takeaway I have from the course itself was really that, and with our cohort meetings weekly, everyone in those discussions, I mean, we created a lot of thought-provoking questions, but it was also very non-judgmental space so that if we had differing viewpoints, that was very much okay. And if someone viewed or needed their birth to look a little bit different than the next person, that was definitely okay. But it was just a really beautiful time to have those conversations and see what other parents were thinking about.
That's good to hear because I know we try to build that into the culture of EBB, but it's good to hear like it definitely filters down through the individual classes that you're taking. And Doug, what about you? Was there anything that stuck out at you as you were learning that maybe you didn't know before taking the class?
I'm have a strong business background, so this is really not in my wheelhouse. I'm a pretty novice in most of this areas. This is what I delegate to the expert over here. But I felt the courses were fantastic for me as a novice, and that it took medical concepts can be very complicated, but it kept things in very common sense language, very applicable and simple for us, so that we could understand all of the different stages of birth and everything that comes along with it. And I really appreciated how the concepts were brought forward and that simple nature, and also, didn't make it elementary or kindergarten for me. It was still like the proper level of detail so that I had the confidence during birth to understand what was going on, what Emily needed. And I think that EBB really did, fit all those boxes and was just for myself, like exactly what I was looking for to give myself more confidence during birth.
Mhm. Yeah, sometimes we see that a lot where, one partner has a lot of experience in healthcare, either personal or work, and then the other doesn't. And it's almost like you both take the class mainly for the partner who doesn't have the experience, but then you both end up learning a lot about each other and yourselves and your preferences. So speaking of your preferences, like what kind of birth were you planning?
We kind of envisioned, as we kind of dove into the information, we really envisioned that kind of spontaneous, unmedicated, natural birth, but we really wanted the safety net of a hospital setting. Very long story, but I've had like some musculoskeletal issues, which led me to chiropractic, a hip replacement. And so I wasn't sure how my body would tolerate birth and what that would look like for me. And I wanted to have a safety net in place, but I still really wanted to really try for that spontaneous, unmedicated birth. So that was really kind of like our vision going into it. And I think as we learned more, there were certain things that we became more open to in kind of a medical sense of like we became you know, maybe open to the idea of using nitrous oxide if we needed it. And we did actually end up wanting like Pitocin in third stage of labor just as something that we had learned, and then giving my like previous kind of medical history that we thought would be a good option for us to have in place. So that was kind of like the plan, the general plan,
Mhm.
but definitely wanting something that in terms of environment was very calm, very warm, inviting kind of space.
Mhm.
So you kind of knew what your preferences were and what options you would be willing to consider if things didn't go as planned. And you kind of had, it sounds like a mix of like you wanted some things more holistic, using your body, and other things you wanted some medical intervention. So,
Mhm.
and the hospital was the best fit for that. I don't think we've had anybody on the podcast yet who's had like hip or pelvic surgery or anything like that. So, do you
Yeah,
mind just telling us a little bit about how what were your concerns about your hip replacement and how that might impact your giving birth?
for sure. So obviously planning for birth was not it was a long plan to even like preconception, get ready
Okay.
for pregnancy and for birth.
Mhm.
So I had a hip replacement in gosh 2016 now, and knowing I wanted to become a mom and kind of starting to think about, or I had started to think about, what were the implications of like hip surgery, particularly the total hip replacement with birth. Are there any higher risks? Are there greater cesarean rates? What does that look like? I talked with both like my orthopedic surgeon about, if there's any risks of dislocation or something like that with a hip replacement. And typically there really aren't, because most of the time you're not in the positions that would create a dislocation. But it's not outside of the realm of like, things to kind of keep in mind and keep in the back of your mind as you're kind of going through this process. So I think like I started digging into research in terms of what were some of those rates of like, were there any dislocation stories that were out there in the data? What are the cesarean rates for women who've had hip replacements? And what I had found, which was really helpful for me and kind of eased my concerns, eased my worries, was that the rates are no different for women who've had hip replacements versus those who have not. And there really weren't reports of high rates of dislocation or other issues. So I felt pretty confident that this would go relatively according to plan. And with all of that information too, I kind of talked to my OB and she as well, she hadn't birthed, I think, with anybody with a hip replacement before, or didn't at least kind of acknowledge that for us, but felt pretty confident that the body would do what it was designed to do and that there wouldn't be any big issues.
Thank you for sharing that with us.
Yeah,
And I can also imagine that in addition to the fear of hip dislocation, you could have some scar tissue or other things that kind of create some unknowns in the process.
definitely.
Yeah.
Definitely. And so I think that was part of our preparation too. Anna was really helpful in kind of instructing us in certain like myofascial techniques. We brought like a lacrosse ball with us to birth, things like that to just keep like that hip more mobile since it is a little less
Hmm.
mobile in terms of range of motion. But
Okay. So take us, to the day your birth story began. Like how did your experience begin?
we had reached 40 weeks in one day, and I found myself to be I wouldn't say I was frustrated that birth hadn't started yet, but I was starting to feel pressure from people around me that birth needed to like get started. And so we had been doing acupuncture, I had been eating dates and doing eating primrose oil, and we were doing mile circuits every day. And then I had talked to a friend who's a chiropractor and also just a very like intuitive healer. And she had said, I really think you need to be in water. Like, I really think you need to get into water. So that evening, got in the bathtub, nothing really eventful. Got out. Doug and I had like some kind of seemingly like meaningless conversation
Mhm.
on the couch and then decided, okay, I think it's time to go to bed. And I had been preparing myself in terms of mindset with hypnosis. And so one of my nightly rituals was to put on my pregnancy affirmations track as I go to bed. So I went ahead and did that, got all comfortable, all the pillows, everything that you're doing at the end of pregnancy. And I hadn't been laying down for probably more than 2 minutes and all of a sudden felt this huge pop and my water had broken and everything got wet. And all I could do was laugh hysterically. And my laughing woke up Doug. And we proceeded to just laugh hysterically for a while.
I thought you were kidding. I thought you were playing
It was a
or
joke.
something for a second, but
So we kind of so without any sleep now, we had called our doula, called our parents, just to get everybody kind of on board. I because we didn't know how quickly then like waves would actually start after my water breaking. So we were just kind of hanging out for the first like 20 or 30 minutes or so, but it really did pick up quite quickly. So we started kind of packing up all the bags and making our way to the hospital. We took a quick 30 seconds to kind of stop in our son's nursery before we left and just kind of said to ourselves, like, okay, let's go meet our son. Here we go.
next time we'll be here, we'll have extra baggage.
Yeah, we'll have our baby with us. So I took a minute or two just to get myself into hypnosis. And then we jumped in the car and really got to the hospital, which was a pretty easy. I know some people have a very exciting like travel to the hospital or to their birthing center. We did not. Pretty uneventful, and we got checked in and into our room, and that was probably I think the first hour that we were there is when I actually experienced probably, more discomfort, which was kind of interesting to me,
Mhm.
arriving to the hospital. Part of the policy was that they needed to take I think it was about an hour of, continuous monitoring before I could go onto intermittent monitoring. And I had to be stationary in a bed, and I didn't realize how uncomfortable that I would feel really being static. Not, like, unmanageable, I could use hypnosis to help me through it, but,
Mhm.
um, it was really challenging. So as soon as that hour was up, I felt much better. We got to get into the shower, or I was able to get in the shower, labored on the toilet, labored in the tub. Because my water had broken, I found the fact that my legs kept getting wet to be very distracting and kept kind of pulling me out of hypnosis throughout the process. So it was when our doula arrived, and she immediately kind of knew exactly what to do. And she said, "Well, we need to get you into water because it'll take away that distraction. You won't feel that, and you'll be much more comfortable." So that's where getting into the shower and then into the tub really became incredibly helpful. From there, our team was just amazing. Everybody kind of knew their role, and I felt pretty confident. It was amazing to feel like the confidence in my own body that even though I hadn't experienced any of this before and hadn't experienced any of these different discomforts, that I very much felt comfortable and like at ease and confident in the process as it happened. We had gotten a few checks for dilation kind of throughout as well. But really that was done like just whenever we felt necessary. They offered it kind of, I would say probably every hour, but definitely didn't take them up on every option. I think there was a moment too where had gotten out of the water and then was laboring in bed again. And it was just incredible. Just the discomfort level kind of definitely increased outside of the water. Because at one point I really thought that I was ready to have a baby, and they checked me and I was only 4 centimeters. So back into the water we went, just create some more comfort. And very quickly went from like 4 to 7, reached finally like 9.5 centimeters after a while, and had an anterior lip. And that was probably the most challenging point of labor for me, in that we kept being kind of encouraged, or I was being encouraged to go onto my hands and knees to help with that, to create that last little bit of dilation to help with that anterior lip. But for whatever reason, that was one piece of labor that just never felt intuitive to me. That did not feel right. My body just really didn't want to go into that position. But I tried different things myself that really hadn't worked. And so I really had to kind of follow some of that recommendation from our nurse to go ahead and take that position. And sure enough, it worked. Everything resolved, and then we were really ready to meet our son.
And what time point in the process was this? So your water broke right when you were going to bed. You went to the hospital without any sleep. So when did you get to the point of pushing?
So we were at the point of pushing about 15 hours later.
Okay. So like the
And
next afternoon.
yeah,
Okay.
so it was about probably 3 o'clock the next day that we were ready to start pushing.
And Doug, how had you been like coping through this process or helping Emily cope?
I was the DJ, so she had
Okay.
all of her hypnosis, well, her hypnosis tracks. She had
Yeah.
her
Mhm.
Bluetooth headphones on, at least in the bathtub, shower. Obviously, it's a little different.
Hmm.
But every 20, 30 minutes would be making sure the next track was going on. Emily would kind of come out of her hypnosis ever so slightly and mumble out like next track or something of that nature. And between Emily's mom and myself, we were making sure that the tracks kind of were smooth. While she was in the tub, we took turns, either rubbing like her back, or taking washcloths and kind of putting those on your shoulders just to help regulate temperature and just give you some comfort there. And, outside of the tub was there to just support, whether it's, different stretching or exercise techniques while you're on the bed, just to, again, sort of distract you from the discomfort and give you, as much, you know, comfort as you can in that moment. So that was kind of the main responsibilities. I had definitely the the main responsibilities were with Emily, but I was there kind of filling in and giving you sips of coconut water when you needed
Yep.
a little hydration.
And Doug, since you kind of had this firsthand view of Emily in self-hypnosis, some of our listeners might not have witnessed someone who's using self-hypnosis in birth. Can you describe a little bit about like what Emily's demeanor was, what she looked like, what it looked like from as an observer, like maybe when she was in hypnosis and then maybe when she was distracted, like during that first hour in the hospital, getting in the tub, getting out of the tub, like how could you tell it was working?
I mean, it's kind of, she definitely had a very strong Zen vibe where, she's very, very silent and very introspective and, is just very heavily focused on breathing. Her eyes are closed. So you could feel the ultra focus that she had. Um, when she's in the depths of the hypnosis. I mean, obviously you're still conscious, it's not like
Mhm,
she's off somewhere else, but definitely it's just your technique to manage the pain and discomfort. But when you're kind of on the edges of between tracks, or you're in having a moment of discomfort on the bed, you could just tell breathing was different. Usually your eyes were open
mhm,
and things of that nature. So that was kind of the yin and the yang of her hypnosis experience. But
mhm,
we've been practicing this for several weeks, going through different hypnosis scripts and
mhm,
getting prepped on the which songs at what time and tracks of that nature. So it was definitely, I was well prepared. Again, something relative I had little experience with, not that you had either, but,
yeah,
I think you did a great job of trying to bring me along and not pressuring me into doing this, trying to bring about, the benefits of it
mhm,
and trying to explaining why you feel like it's important for your birth experience, and definitely made sure I was there with you and that it wasn't like you off by yourself. Um, so I felt like you're doing so much, like the very least I can do is support, this choice you're making. Again, it's not the as I feel like you're doing a lot more of the heavy lifting.
Yeah.
So that
yeah,
was our
mhm.
hypnosis experience.
And what was your doula doing all this time?
Our doula was I mean, she was all kinds of things. I think for me, I was less aware since I was in hypnosis so much, but she was just offering a lot of suggestions about whether it was getting into the shower, getting into the tub, or giving me like little cues for relaxation, putting a hand on a shoulder, a hand on a forehead of like where to just release
Mhm,
tension, or even at other stages, giving us cues about using some of like the spinning babies techniques to help with comfort and alignment. And then likewise, she was also our birth photographer and taking lots of pictures for us so that we could document the experience. But it was really great to have really the full team and just to have kind of that. Our doula, I felt like was just like our coach, like was there to give just to coach everyone else to make sure Doug was where he was needed to be, where my mom was where she needed to be, and that we were all kind of unified and on the same page. So having a doula is absolutely invaluable to
mhm.
the birth experience.
And
Yes.
how did you all work then to create this environment? Like, Doug, you described it as very zen, so that people didn't come in the room and maybe interrupt your focus or start throwing out words or, sentences that could like bring fear and anxiety into the situation.
Yeah, we had one kind of occurrence of that where I think someone had kind of walked into the room and hadn't seen all the signage that we had put on the door and kind of walked in like very much happy as could be, but just very boisterous, which was not quite the energy in the room. So we had signs that we had put up on the door before people had entered to let them know that I would be in self-hypnosis, that I wouldn't necessarily be available to answer questions right away, but maybe I could at the end of a wave or once I came out of hypnosis. also I think like having dim lights and even some of like the tea lights and twinkle lights and things like that to help kind of like create that ambiance in the room was really helpful for everybody who was kind of walking into the space to know that it was more quiet and more serene. Yeah.
I think the nursing staff was very, very supportive, and they definitely took our birth plan, saw the environment that we were choosing, and I think they did a good job of socializing it amongst their floor to make sure everyone knew
Mm.
kind of just how we were approaching it, and there was no pressure. Are you sure you want to do that? Or they pretty much took us at our word, saw what we wanted to do, and supported us, which is you know, not everyone may have that situation.
Mm.
We're very lucky and blessed to
Mhm.
have a good staff with us to make that happen.
Definitely.
And you mentioned when you wrote into EBB that the hospital staff there might not have seen many unmedicated labors. So, you know, were they in awe? Doug, maybe you noticed more of what was going on. Were they just, respectful? Were they kind of like, what was their reaction?
There that definitely, I think, as the day progressed and I guess the word got out amongst the scuttlebutt amongst the floor, I think there may have been a few more visitors near the tail end. I think one aspect of the tub room was that it did provide you kind of a somewhat of a barrier
Yeah.
between the outside noise and, you know, which was good to help you maintain kind of
Mhm.
your focus. So during kind of the main, as you're going through your phases and your dilation, you were pretty kept to yourself. But once you kind of hit the pushing stage, I think there was a little bit more excitement
Mhm.
that came in. But again, folks were respectful and that people weren't poking and prodding you. I think folks were there giving you your space and us our
Yeah.
space.
I think there was definitely like a general excitement with the staff to be able to kind of, and I think the excitement definitely came about after he was born where they like realized like, wow, I actually got to see this like full spontaneous kind of unmedicated, like really just like natural childbirth. And so we were kind of, everyone was very kind of, yeah, like kind of golden retriever, like excitement, over it, which is really exciting for us to see that people, were really enthusiastic and really wanting to like experience that. And it wasn't looked down upon at all.
Mm, yeah. Well, it's pretty amazing that you two were able to, with your mom and your doula, create that environment that made them feel like the staff were part of this experience and on the same team as you and wanting the same goals in a hospital setting where this is not the norm. You were kind of like an unusual I wanna say spectacle. And I don't encourage people to say, "I'm gonna go in and show them how it's done."
Right.
Because first of all, you don't know how things are gonna go, and second of all, it's not their birth. Like, you're not doing this for them.
Mm-mm, right.
But it's always lovely when afterwards you can say you were part of, like, an experience of opening people's eyes to different options and ways of birthing, and so that's a really cool aspect of your story. So take us to, the pushing phase, the second stage of labor. You worked through that cervical lip. How did the pushing phase go? What was it like?
So right before we started pushing was when I had voiced the first time and the only time throughout the entire process, and I had finally said a full sentence, and I said, "I can't do this," to my birth team, and every single person around me immediately said, "You can do this, you are doing this, like, keep going." And that was the first time too where I started to explore, like, maybe I do need some nitrous. Maybe I need something to just kind of like help me through this last little bit. But that was essentially when they came in and it said, you're 10 centimeters. Like we can either start pushing or we can wait for nitrous, which would, which option? And so I said, of course, like let's just go for this. Let's just start pushing. And truthfully, like, I mean, I know people talk about this a lot, but it is so true that transition is the hardest. Transformation is the hardest phase. The pushing, I wouldn't say is easy by any means, but is definitely more gratifying. Like there's something for you to be doing during that. So it feels much better than that transformation transition phase. So I had started kind of pushing. I was in bed and I was pushing on my side for a while. It wasn't quite making progress that way. And in my brain, like in my birth plan, I had thought I'm going to push on my hands and knees, which like we had already found out that didn't feel intuitive at that point, which is very interesting. So I ended up pushing on my back. I was pretty tired at that point, and we had a little bit of kind of coaching that kind of came out a few times from hospital staff, the counting, which kind of was disruptive to hypnosis. Everyone was very like we asked them to kind of stop doing that, and that was very easy conversation.
Mhm.
And they're very much agreeable to it. We had our hypnosis track playing out loud for everyone in the room when pushing started, and I pushed for probably 90 minutes, and our son was born, and it was amazing. Like it was the most incredible experience. Our doula like captured this amazing photo of Theodore crowning, and you can actually like I'm have the biggest smile on my face 'cause I'm just so excited that he's here. We're gonna meet him. Our OB, I was so just grateful for that she really had a more. I mean, we talked about this with Anna at like our postpartum kind of session with her that our OB really had like a hands-off kind of approach to birth and really did like allow Theodore to kind of like birth as he was intended to, kind of in that like innate process and those the cardinal signs.
And the OB wasn't rushing anything.
Not
No.
at all.
Mhm.
Just really let it happen as it should. And she really made me feel like I was the star of the show. And I was very, very appreciative of that because I think at least like, and like television and movies aren't a good depiction, but I think sometimes you're always left to think that the care provider comes in the end and they're like the hero, like delivering the baby and like absolutely not. Like I birthed my son. I did that and she absolutely made me feel like that was my accomplishment. And that this was our accomplishment really as a family.
Doug, what feelings or thoughts were going through your head when your son was born?
I think it was somewhat of an overwhelming process just thinking about how all of the steps we had taken to get to this point, were very, very much planners. Like we've been thinking about this moment for years
Mhm.
and getting ourselves, our bodies and our minds prepared for this. And I think it was just like I've had a rush of I felt just overwhelmed by the fact that we're finally there. That's the moment you've been thinking about, and it's kind of captures your whole psyche, in those months leading up to birth. And it was, yeah, somewhat overwhelmed, somewhat relief, knowing for Emily's sake, it's very hard as a partner to see this person you love like giving so much, and you feel like it's we just have different roles, but being able to see, knowing that you're through the majority, the largest part of your discomfort and pain was also something that I was just grateful for to see, and just grateful to see our little boy. And I mean, it was kind of hard, indescribable moment
Aw.
too as well.
Mhm.
Um, but just you know, lots of emotions, lots of happiness
Mhm.
as well.
Well, thank you for taking us there in that, moment so we can kind of hear what it was like. What was your postpartum experience like?
Postpartum was the single most challenging and rewarding experience of my life. Um, I mean, more challenging than any board exam, and I've taken lots of board exams, but more challenging than anything I've ever done in my life. And we had said between the two of us, it was kind of a common theme throughout postpartum. We were sitting ourselves like, we have how many advanced degrees between the two of us? And like this is the hardest thing we've ever done. It was a challenge. It was a blur, but I was so excited and so grateful to really like bond as a family in such a new way, and also to like kind of face some different or like unexpected challenges, and really come out and see ourselves come out stronger on the end. We had a lot of like more difficulties than I think. We had some difficulties with breastfeeding and with latching. And so that was a big challenge throughout postpartum, was kind of a big theme of postpartum for us, more than anything else. But one of like the biggest tools that I think was really helpful throughout that time period was that my perinatal counselor had kind of recommended, like, before birth, she said, "Hey, I want you to take, just make a list anywhere of like things that you think might be issues kind of in postpartum, or like challenges you might face. And I want you to just list out all the people that you can contact about that single question or that issue. So maybe it's housework and laundry, or maybe it's meals, or maybe it's lactation, or maybe it's questions about your health, or whatever it is. Make the lists of people who have either have had kids recently, or have also breastfed, or add La Leche or an IBCLC, or whoever you have like in that list. So when you're in the haze and the fogginess of postpartum, when it's challenging to like think through solutions, that you have a very like quick reference guide to say, you know, this is what I'm having a problem with. Like, let me call this person and just see if they can offer any guidance for us. And that was incredibly helpful. It was so simple, but then in postpartum, it was great when I was having these issues with latching and breastfeeding, that I had my resources kind of ready to go. And so I was making appointments with people, at 2 a.m., as I'm trying to do a feed, and like can do it on my phone while I'm feeding, to get things in place when I'm facing these challenges. So that was a really helpful tool. And I think you know, we were as prepared as we could have been, not knowing what we were gonna face. I
Right.
mean, we had all of the lists, all of the meals in the freezer. I mean, we had our kind of toolkit ready, but I don't think you're ever gonna be quite like, you're not gonna walk into
Mm.
postpartum feeling like, "I can ace this," like you could like a test.
Especially when you've never done it before. It's like you
Yeah,
said, you
right,
don't
right.
know what you don't know, and you're learning your baby, and they're learning you and
Yes.
life, and
Yes.
you're learning how each other is coping with
Yeah,
this huge challenge. So,
definitely.
love the tip with having everything at your fingertips ready to text for help or call for help,
Yep,
because you're gonna need help.
yep.
So, we do know that much.
Yes, yes.
And what was the hypnosis program you used, if you
I used Hypnobabies,
Okay.
and I
Yeah.
just did their home study course.
Mhm.
So they
That's
have
good
kind
to
of a
know.
whole.
I think, I thought that's what you were saying from what you were describing, but I think it's good. It was interesting to hear how the EBB kind of you were able to weave it together with the hypnosis training to kind of create the best of both worlds. So, loved hearing
Definitely,
that. Yeah.
definitely. They very much complemented each other for sure.
Yeah. And then I have one last question. Emily, this one's more for you. How did your training and experience as a chiropractor, impact your journey through pregnancy and birth?
Yeah, I think kind of from a practical perspective, it definitely lended itself towards, understanding body biomechanics, understanding good nutrition, understanding the different kind of tools or tactics that are available to me for different like musculoskeletal complaints. Um, but then I think like from a broader sense, or like from a philosophical sense, chiropractic is very much based in really trusting like that innate intelligence within our bodies. And so I think from a philosophy standpoint, it really led me to trust really the entire pregnancy, the entire birth process, to really understand that pregnancy is not an illness. It is a natural state of being. It's a healthy state of being. and that our bodies can do this without any kind of conscious effort from ourselves, that we can kind of sustain another life and we can birth another life without a lot of extra additives to it. And then likewise, kind of from that same philosophy of really looking at my baby and saying, like, my baby has their own innate intelligence too. And I can trust my baby to also go through pregnancy and birth well. So I think of a few things of like that physical being and like taking care of like good nutrition and good movement, but then also from that really like philosophical kind of
Yeah.
mindset.
Yeah. Well, Emily, and that's a great lead into next week, because next week we have Dr. Lisa Vouter, a chiropractor, who's going to talk about how chiropractic care can help with the aches and pains of pregnancy. And she talks a lot about managing the load of pregnancy and all of the demands on your body and how chiropractic helps with that. So I think your birth story is a great lead in to discussing more in depth about chiropractic care. And also, if you're interested in hypnobabies, our listeners, you all can check out episode 322, which we talk with the founder of hypnobabies actually about how she created that curriculum and what it all involves. So this has been really like educational and inspiring, Emily and Doug, and to see like how birth and pregnancy has strengthened your relationship. And it's just like really visible the love you have for each other and for your son. And so we're
Thanks.
really grateful that you were here today.
Thank you for having us. This has been such a pleasure.
Thank you so much.
This podcast episode was brought to you by the Evidence-Based Birth Childbirth Class. This is Rebecca speaking. When I walked into the hospital to have my first baby, I had no idea what I was getting myself into. Since then, I've met countless parents who felt that they too were unprepared for the birth process and navigating the healthcare system. The next time I had a baby, I learned that in order to have the most empowering birth possible, I needed to learn the evidence on childbirth practices. We are now offering the Evidence-Based Birth Childbirth Class totally online. In your class, you will work with an instructor who will skillfully mentor you and your partner in evidence-based care, comfort measures, and advocacy, so that you can both embrace your birth and parenting experiences with courage and confidence. Get empowered with an interactive online childbirth class you and your partner will love. Visit evidencebased birth.com/childbirth class to find your class now.